We started the Encore Fellowship in California community clinics. About 10 months after we started with the idea, we now have 16 fellows placed in clinics throughout the state. I think many of the fellows are really effective at engaging the leaders in the clinics in a dialogue about why are they doing things these ways. They hear some other alternatives, not necessarily that they have the solution, but some different perspectives on how things might be done differently. In some ways, having fellows who aren't imbued in healthcare, who aren't fixed in their ways and thinking about how to deliver healthcare, can really bring some processes, some approaches, strategies, and tactics for thinking about how we could do a much better job in healthcare. One of the things that I think Encore Fellows bring to their next phase, if you will, is they bring a fair amount of experience. They bring a lot of life lessons, and they bring a lot of wisdom, if you will, into whatever they do. The kinds of mentoring, coaching, and dialogue that, frankly, I would argue sometimes older people are a little bit better at: listening, thinking, reflecting back, helping people problem solve, and frankly are not the kinds of things that many physicians either have the time or sometimes even the patience for. So one of the reasons that we chose the community clinics is that they are really what we call a safety net delivery system in our state. They're community-based, they're very much focused on the needs of the folks literally in their neighborhood. They serve a significant proportion and provide a significant proportion of the care to what we call the underserved. And in that setting, they are strapped for resources. They're really struggling to provide high-quality care in a higher volume. And with the threat of healthcare reform, there is the possibility that they will be asked to serve more and more patients. So the Encore opportunity for us in the community clinics in California is bringing the skills and expertise that have been honed in the private sector and really bringing them to bear in healthcare delivery in our state, especially for the underserved. The California Healthcare Foundation's commitment is to really launch the Encore Fellowship in community clinics, not only in our state, but really to set the groundwork for this whole movement to really grow and support healthcare.